Hello and welcome to Sensei podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello and welcome to Sensei podcast. It is my great pleasure to introduce our guest today, Dr. Mario Iannaccone, who is an interventional cardiologist at the San Giovanni Bosco Hospital in Turin, Italy. A great friend, a great CTO operator for many years. So good morning or good afternoon for you, Mario, and thanks so much for joining the Sensei podcast today.
Hi, everybody. Thank you, Manos, for this great opportunity. I'm really happy to be here with you.
Wonderful. Thanks again, Mario. And I always like to start this with a brief overview. Tell us, how did you train? How did you get involved in this complexity of PCI? What was the thing that made you go into this area?
Okay. My journey in PCI started when I was during my cardiology fellowship, and I really felt in love with PCI and in CTO in particular. And I think that everything really started once I get into CTO PCI world with my mentor Roberto Garbo. He didn't work in my university hospital, but he came there as proctor for a proctorship, and it was the first time that I saw him. And since I saw what he was able to do during a coronary intervention, I really felt in love, and I started my journey in this wonderful world.
So, which hospital were you back then? Where were you training at?
I was in Turin University Hospital. After my medical degree in Naples, I moved to Turin for the cardiology fellowship. Turin was in the days and also now a good school for cardiologists. But in that moment, there was not a great experience for complex coronary intervention. So for really complex patients, they had a proctorship with great mentors. And at that time, I was really, and also now, I'm really enthusiastic to really understand, get deeper and deeper in the field. And I think that the enthusiasm and the curiosity to really understand the procedures is what really make me enter in this world.
But how did you do it? So you had some work with Roberto Garbo, who is a great teacher and great CTO operator. But from getting some initial experience and to becoming yourself better and better, there's a lot of work in between. So how were you able to get this experience in?
It's a long journey that never ends, and of course, at the moment, I really don't think to be as expert and experienced as big operators. I think that we have to take in account the Italian system. The Italian system, there is not a certification that makes you an interventional cardiologist, okay? You can proceed with your fellowship until 50 years old if you want, and never perform a primary PCI by yourself. By yourself. So it's a strange story because it's just yourself that feel to be ready, okay? And you have to jump into the game in a certain moment that you feel really feel ready. So once I finished my fellowship in the University of Turin, I moved to San Giovanni Bosco. In that period, Roberto was the chief of the cath lab. I was there for 1 year as post fellowship, Okay, I was already cardiologist, but I wanted to continue my improvement and learning in CTO, PCI, and complex coronary intervention. And I was there for 1 year and a half, more or less, after the cardiology degree. Then, when I felt ready to start my journey, I moved. I got a position in a little hospital near Turin. That was a little center, about 600 PCI per year, but we were just 2 operators. So, and it was 24 hours on call. So little cat lab, but a lot of work to do, and there I really it was just we were just 2 operators, and so we had to do our job and try to do our best. And I really felt that the moment that I was able to jump in this or start to fly, it depends from the point of view. In that moment, it really started everything. In the beginning with the standard PCI, then to complex PCI, the first rotational atherectomy, the first complex left main, and then also for the same for CTO PCI.
Wonderful. So, and then when you moved back to San Giovanni Bosco after a few years?
I moved there after 2 years because one of the colleagues in the cath lab moved to be the chief in another hospital. So he left his position in San Giovanni Bosco, and Roberto asked me to come back in San Giovanni Bosco Hospital and get the position there. So it was about 4 years ago, more or less.
Wonderful. And then, so you were very in a position where you did a lot of cases, which obviously helps a lot. And then you went in a hospital that, with the transition with Roberto and the previous, that was very experienced in doing these complex interventions. What did you find the most difficult thing to learn in terms of complex PCI and CTO PCI?
There are many aspects that we have to consider. The first is the technical aspect. The second is managing with the everyday life with your colleagues. From a technical aspect, the thing that is most difficult, in my opinion, to learn is probably how to really visualize the occlusions. I mean, when you are doing a CTO PCI, when you track your gut wire through the occlusion, you have some feedback from the wire movement, from your hands, from your eyes. But indeed, at the end of the day, I think that one of the most important things is try to visualize how the vessel should be and which is the correct track that the gut wire should do. Because if you have in your mind, in your eyes, what should be the anatomy, then you will track correctly, and you will do everything that it is important to do. If you don't visualize the occlusion, the anatomy, I think that you may have chance to have a good results, but it's just luck, in my opinion. If you really understand the anatomy, it's not luck; it's something different.
And is this from the angiogram, or is this using CT, or just different views? How do you best understand the anatomy?
I think that to really go through the angiogram is the first fundamental step. But go really deep in the angiogram I really love also tip injection, to have selective angiogram, proximal cap, distal cap, collaterals. I really need to have a real reconstruction in my mind of what's the anatomy. Otherwise, if I'm confused about anatomy, I try, but each time that I am confused about the anatomy, my success rate really go down.
Okay. Now, apart from getting the anatomy, in terms of the techniques, undergrade, retrograde, the techniques, what did you find the hardest one to do?
What I found the most difficult is probably from retrograde, how to manage the resistance and the feelings of the materials going through the occlusion and going through collaterals. I mean, you need a lot of experience to really understand how much you can push without creating complications to the patients. I think that is one of the most hard things to really understand. From a technical point of view, I've saw so much from Roberto, from you, from many other experienced operators. So the techniques are really clear in my mind. But there is anyway a part of experience and that you can learn just doing intervention by yourself.
And how do you deal with failures and complications, which, as you know, do happen to everyone, even the best operators have this. So how do you deal with this? Does it affect you? Are you able to work through them? Do they get depressed?
This is a fundamental point in every intervention. For example, when I was in the little hospital that I told you before, I had a really important complication. It was one of the first 100 PCI that I did by myself as an operator in a new cath lab, and I got a tremendous right coronary artery iatrogenic dissection due to the guiding catheter. This is, I think, one of the most common and scenarios that in interventional cardiology may deal, especially in the first year of his experience. And I think that these are the most important moments of a career for everybody, but in particular for young operators like me. Because you learn a lot from yourself, you learn a lot of who you are as a person. Which kind of person are you? And how you can deal with your emotion, with yourself, because once you have learned a lot and you have studied a lot, it's no matter of technical aspects anymore. It's just yourself, how to deal with your emotion, how to deal with a patient that is suffering. To answer to your question, frankly, for me to have an unsuccessful CTO PCI or a cheap PCI, it's not an issue. Because I can learn from a procedure, I can learn a lot, I can try to do it again, I can try to do it with somebody who has more experience than me, so it's not an issue, an unsuccessful PCI. Different story is if you have a complication. If you have a complication, so in that case, you have to deal with yourself, try to solve, and if it happens that you are not able to solve that complication and the patient goes not so well, you have really to stay on that case also for a month, but you have to really learn the most is possible to learn to really understand what went wrong, what you could do differently, and how something like this should be managed correctly.
Wonderful. And as I think many people have said, the complication is what it is and it's tough, but also it's an opportunity for learning, and potentially some of the patients in the future will benefit from what happened before and the learning that went through that. How worried are you about radiation? Do you have any specific ways to protect yourself? I know you do a lot of cases. How do you protect yourself from radiation?
If I have to be sincere with you, I am not really worried. I mean, I took in account this problem when I started this journey. If you are afraid about radiations, it's better not to do this job, because also radiation exposure is mostly stochastic damage. Is not always deterministic. Anyway, if you have issue about radiation, most of the time is a stochastic event. So to reduce those, for sure, it has an impact on your life, on your healthy, and this is sure. But anyway. It is important to keep attention to this point, but not be afraid of this too much. Anyway, in my everyday life, I just have the normal attention that everybody does, the shields and everything on. I hope in the near future we'll have the rampart or something like this, because what I'm really afraid of is not radiations, but is healthy due to overload on the back and this kind of issues. Because if you do a lot of case, you may have this kind of problems really often. I saw a lot of operators having issues, and also sometimes, despite I'm young, I can have this kind of problems. So I'm really much more afraid about this than radiation.
Wonderful. And then when it comes to people, because now in the cath lab you are training other interventionalists, or if other cardiologists who become interventionalists, are you looking for something in the people you train? Do you say, okay, this person is going to be great in doing this, or this person is not? Is there something that you can use to predict if this person is going to be a good interventionalist or not?
Manos, this is a great point, I think. This is a great point because sometimes I saw some people that, in my opinion, were really great, had really the attitude to be great, and they're doing well. But some other times, I saw some people that I would not bet on them, but with hard work, they really improved so much, and they became a really good operator. So if you ask to me that if everybody can become a good operator, my answer is, I think, yes. Everybody can be. It depends on how hard you want to work. For sure, there are some attitudes that make this easier, some other attitudes that make this more difficult, but I think that everybody can become a good operator. On the other side, if you ask me, everybody can become Manos Birilakis or Yamane or Roberto Garbo in top 20 operators in the world, probably the hard work is not enough. You need also some personal attitudes over hard working, of course.
Absolutely. And then how many cases do you think it takes to become good at doing CTO and complex interventions?
I think that for complex intervention, if you are in a high quality cath lab doing routinely protect PCI, debulking, imaging, and so on. If you are in this kind of quality of cath labs, I think that 1,000 PCI it's enough to become an experienced operator. Once you reach 1,000 PCI, but it has to be this kind of PCI, of course. 1,000 PCI with 8% of rotational atherectomy, 5% of protect PCI, at least 30 left main PCI per year. If you are in this kind of cath labs, I think that 1,000 is enough. For CTO PCI, I think is much more difficult to understand. I don't really think to be to be expert and to be in this moment at this level. So I can say that probably you need at least 200 or 300 of CTO PCI on top of the 1,000 PCI that you did for complex.
Wonderful. And then, Mario, how do you feel now for the case? You do a complex case. Do you get anxious? Do you get nervous? Are you overcome that? How do you feel before these challenging cases that you are doing?
No, I'm really happy. I don't feel anxious. I'm really happy. I'm really excited. I have to stop. I have to be a little bit calm when I'm starting, because otherwise I'm too excited, and so I have to stop a little bit myself while I'm doing some things. There is only one thing that really became a little bit anxious, is if I had not a correct not agreement, it's not the correct word, the correct communication with the patient. If I had a correct communication with the patient and with the family before the intervention, I'm really calm. I'm really calm and happy, and I know that everything will go in the correct way. If I had not the correct communication with the patient is not so conscious of what I will do, or the family the same is not so conscious of what is going on. In that scenario, I feel a little bit more anxious, if I have to be frank with you.
Okay. And then you are one of the few people who can do the complex case, but at the same time being very productive in academic work, in publishing, several very well thought of and done papers. How are you able to balance those two, the clinical demands of a busy cath lab and being so productive in your research?
This is another story, Manos. It's really hard. I am still trying to find a balance between my life, my personal life, and my job. Actually, the most of the time that I spend in doing scientific research is when I'm on call. During I'm on call, I'm on call about 10 days a month. So while I'm on call, I take sometimes to do this kind of for doing my research, statistical analysis, and it's really hard to find a balance between your personal life, the cat lab, and the scientific research.
So you essentially take advantage of every time, the in-between cases, the waiting time, which is a great way to do it, and sometimes the only way, because as you said, the lives can be very busy. And how did you learn to do the research? Did you work with other people? How did you learn? Done many great papers so far. What did you learn, and which was one of the your favorite papers you published so far?
In scientific research, I had not a mentor. In scientific research, I had a lot of cooperation with my colleagues, younger or older colleagues, but we are talking about 2-3 years of difference, and we learned a lot from each other. For example, I studied statistics by myself. I've learned by myself how to perform analysis, propensity score, meta-analysis, direct and indirect meta-analysis, and so on. But everything by myself. I've learned a lot from my mistakes and from reviewers when I submitted a paper, and a reviewer really get in the deep of my papers and highlighted some criticism, and for me it was really important because I've learned to do scientific research from my mistakes. With scientific research is much easier than in the cat lab, because anybody is suffering. only me.
Yeah,
Only
absolutely.
me. But this is the way I learned. I learned with my friends and just doing the best that we could do.
Wonderful. Well, and what are some of the studies that you are most excited about, the things that you've done that you found the most interesting so far?
I think that the studies that I were more excited to publish were not at the end of the journey published in a top level journal. For example, there is a little paper that I wrote with the group of CTO operator from the EuroCTO PCI EuroCTO club about the impact of CTO PCI in ventricular arrhythmias. It's a little paper that I think that it's really interesting, but it's observational, retrospective, many limits, but I think it's quite innovative. For example, this one, or there are some meta-analysis that I published on European Art Journal or other journals of the European Society that I'm really proud of. But I'm really happy and for what is coming, because this little group of friends is growing up all together, and we are doing some little RCT, we are improving a lot the quality of our research, because I think that in the beginning of our journey in scientific research, the quality was a little bit low. And then we are trying to improve, and we are doing some RCT, and I hope that they will be published good.
What is the RCT you're doing?
Actually, we have finished the enrollment of an RCT regarding doing a coronary multi-slide tomography after main PCI after 1 year, to understand if these non-invasive tests can impact on the outcome. And another RCT that we are enrolling at the moment is the impact of complete revascularization in ST elevation myocardial infarction guided by OCT findings. You do OCT in a non-culprit lesion, and according to OCT criteria for plaque instability or plaque burden, you go for PCI or not. And this is the intervention arm, while the control arm is standard of care. So you can do whatever you want, FFR, medical therapy, or PCI. Every operator can decide by himself.
Wonderful. Again, congratulations. I mean, these are obviously big clinical questions that remain, and doing prospective studies and my studies in this area is very challenging. So congratulations on doing that. Now, how do you keep, Mario, how do you keep in good shape for doing all this? Do you exercise? Do you do something to calm you down, to relax you? How do you keep fit to do all this work?
This is also an important point for young operators. You have to understand that keeping your body healthy is fundamental to do everything you want. Especially think that everybody in the beginning of the career is so much focused on the cath lab, scientific research, and so on. And for example, there was a time during COVID. I gained a lot of fat. I was 10 kilos more than now, but at the end I understood that it was not healthy, and I have to really care about myself and about my body. So I started to do some sports, some tennis, and going to the gym to keep healthy. Because if I felt better with myself, I was also much more successful in everything I was doing. Also, it's when you wake up in the morning, you go in front of your mirror while you're cleaning your teeth, and you see something that you like. I think is important. You feel better, and your day will be better, I think.
And do you have a favorite book or a favorite movie?
Yeah, I read quite a lot. It depends on periods, but I read quite a lot. I think that my favorite book is the Count of Monte Cristo. I don't know how to say in English.
Yeah, no, this is exactly the same.
Yeah, Edmund Dantes, I think, is one of the most fantastic characters of books. And on the other side, I really like also science fiction and fantasy, like Lord of the Rings or Dune, for example, also is a great book. Now the movie also is a nice movie. And sometimes it depends on the periods. If I'm reading just to enjoy reading, or because I want to think to something. I also like a lot of philosophy. I read a lot of books about Nietzsche and Greek philosophers. So I really like also this kind of books, but just in some periods. It depends.
So you keep busy. And how about a movie?
About movie, I love most of the George Lucas movies. So Star Wars for me is I don't know how many times I saw all the Star Wars saga, and I saw Star Wars just until George Lucas was the producer. Then after George Lucas, for me, Star Wars is not Star Wars anymore. It's something different. Indiana Jones, it's the same. and I like also Quentin Tarantino movies a lot, really a lot, and also Guy Ritchie movie I really like, and as you know, also The Godfather is a great movie for me.
Absolutely. What is things that excite you the most so far? Like, what is the thing that you look forward to in the near future?
This is another question. I think that what I really looking to in the next future is to try to work in an healthy environment with good people. Good people that really care about patients, about scientific research, that really want to improve, that really want to be innovative, and I think that create a team of people, not necessarily working in the same CAD lab on the same institution, but all over the world, Europe or US, doesn't matter. But a group of people that really want to improve by little step all together, and in a healthy way. I don't know if it's a strange, probably it's a strange idea, but this is what I'm trying to do in this moment.
Perfect. And then, what are you most proud of from the things you've done so far?
You mean in life or professionally?
Both professionally and in the personal.
I think that I'm in the very beginning of my career and in my life, and I think that I feel that I have so much to do, and I'm a little bit probably. I'm a little bit incomplete. I feel incomplete. So it's not the time yet to feel proud of something. I hope one day to be proud of myself and what I did and what I'm doing, but I feel at the moment that it's like when you are downloading something from the web, from a website, and the little bar 30%, 40%. Now I think my downloading is 30-40%.
Well, I mean, there's many things obviously that you've done very well. I mean, there's very few operators that do complex work, and there are even fewer who do the complex work and remain academically active and doing studies and publishing like you do. So there's many things to be proud of, but obviously you're keeping very humble, and which is greatly appreciated. If you had to give any piece of advice for operators who are young and are thinking of following your footsteps, doing the complex intervention, the academic work, what piece of advice would you give them?
The most important advice for me is to have passion in what you are doing, to really love what you are doing. If you love what you are doing, everything will go in the right way. You will never lose because you are doing what you really love. If you are doing scientific research or you are doing PCI, complex PCI, just to be famous, to be rich, to be acknowledged by everybody, something like this. This is not the correct mental status for this kind of job. If you're doing something because you love it, you'll never lose. This is my and don't be afraid and be innovative in what you're doing.
Wonderful. So great pearls of wisdom, and you're absolutely right. This thing takes so much time and so many hours that to even be able to do it, you need to have the dedication to whatever your field of area, especially complex PCI, is doing. So Mario, thank you again so much for taking the time today. Again, congrats on creating all this work so far. And again, you're very modest, but you've published extensively, done tremendous clinical work. So I think you're a great role model for other people coming down the line. So thank you for taking the time today, and super excited to continue to work and learn with you.
Thank you, Manos. Thank you, everybody. I hope that you really enjoyed this session, and it was a great pleasure for me.
Thank you for listening to the Sensei podcast.